Assalamu alaikum. My name is Dr. Nasirullah. Today, the journey of our Master in Health Data Science leads to our sixth lecture, which is Data Science Pipeline in Health. So, what is the main question of this lecture? The main question is how can we use data science in health? In this lecture, we will learn the four stages of health data science pipeline, which starts from data collection up to the decision making. Then we will critically evaluate common data sources, quality issue, and privacy ethical constraints in health. Select and apply appropriate tools to clean, transform, and integrate heterogeneous health data. Design reproducible analytical workflow and translate statistical outputs into clinically actionable recommendations using modern visualization and decision science framework. So in this lecture, our basic stages are data collection, data wrangling, data analysis, data visualization, interpretation, and decision making. So we will start from our data collection. How can we collect data? So first, what is health data? Health data is anything that tells us about a person, biology, behavior, and environment. And the sources of health data can be different. It can be collected from electronic health records, like a patient hospital chart flow. It can be collected through research studies, which can the data can be collected through a questionnaire, interviews, and observations in qualitative studies. Then there are patient registries and surveys. In patient registries and surveys, these are organized databases. They track patients with a specific disease and who receive a particular treatment, like a cancer registry collecting outcomes of breast cancer in patients. So the next is medical imaging and laboratory data. Medical imaging is radiology images like X-rays, CT scan, MRI, and laboratory data are pathology slides, blood test, genomic sequences. Then there are variables and mobile apps data, which can be collected through smartwatches and smartphones, like tracking physical activity, sleep, or heart rate, and public health surveillance system, which is population level data on disease spread, vaccination coverage, or mortality statistics. So, why is data collection important? Data collection is important because each source captures different aspects of health and combining them gives a fuller picture of patients and population health. So the data can be collected through a questionnaire, interview, which can be focus group discussion or other type. Then there is a surveillance, medical imaging, and laboratory data, and then there is a picture of wearable devices data. So what are the types of data? There are three types of data. The first one is structured data, which is organized data, which is in columns and rows, easy to store and analyze. Then there is unstructured data, which is free text or complex format. These are harder to analyze. These are first organized into a structured data and then we can analyze it easily. And then there are semi-structured data, which are partially organized. So these are the illustrations of different type of data. The structured data, you can see there are names to each columns. And in unstructured data, there are only papers on which the surveys or questions are written, answers are written, and then there is a semi-structured data which are partially organized, but it has to be organized into a structured form so that we can analyze it easily. In data collection, there are some challenges like data privacy and confidentiality. missing or incomplete data, multiple formats or and data standards. Example is collecting blood pressure readings from hospital records and wearable devices for hypertension studies. So coming to our next stage, this stage is a data wrangling stage. It is the pre-processing of data. Once the data is collected, it is often messy or inconsistent. Data wrangling is the process of cleaning and organizing it into a structured form. The steps involved are: first, we have to examine our data, examine its shape, examine its format, and then after examining, we have to transform it into a structured data. So the first thing is data cleaning, like removing the duplicates, handling missing values, and correcting errors. The second is data transformation, convert data types, standardize, unit, normalize, or scale values of modeling. Then there is an integration of data which combines data from multiple sources, and data reduction which removes irrelevant variables, summarize large data sets for efficiency. So why the data wrangling matters? In health data, incorrect pre-processing can lead to false conclusions that directly affect patient care. So we will now practically do it, how to use data wrangling. So we can organize our data through AIs like ChatGPT, Kim AI. You can also use Kim AI for it. In these AI, first you have to upload your dataset. Once the dataset is uploaded, then ask that find what can I do in this data to wrangle it for analysis. So it will analyze the data, and then it will give us what are the problems. We can also do it manually, but as the AI has come, it can save our time. So it tells us about that there are no column names in this data. I can show you this data, that this is our data, and there are no column names. As you can see on the top, there are no column names. So first we have to add the column names. Then there are missing values which are noted by this sign. Then there are duplicates, like this number is appearing multiple times, and we have to convert some data into numeric and standardize and then split the data. So when we ask the AI to show us where we can wrangle our data, it will tell us where you need to correct or organize your data. Then we have to ask about the codes of R or Python. We can use both the R or Python for it. I am using R. You can also use Python for it. So it has already given us the codes. So we have to just copy it to the R. So if I am importing the text data, then I will select the text reader, browse your data, enter your data. This is our data, and it will take some time to process it. So once the data is processed, you can okay, now let me correct the codes. So okay, this is our data. First I have to convert my data name into data. Now my data name is only data. Okay, I have already copied the codes in this script. So in R you have to install the packages. If you have already installed the package, just load it, and if you didn't install the package, first you have to install it and then you have to load it. Here with this code we can see our head of the data. As you can see here, there are no column names. You can also look into the data, and then this is the view form of the data. There are no column names. So first I have to add the column names. Okay, I have created this code to add the column names to each cell. There are 14 columns. Okay, this is another data. Let me import the other data set. So now this is our data. You can view your data in here. So there are 14 columns, and then we have to add the column names according to the data. So this is the code to add the column names like call names into data, and then these are the column names. Once you entered it, then view the data, you can see that the column names are being added here. Column thickness, ID, cell size uniformity, cell shape uniformity. Then coming here, we are now removing the missing values. In the data, the missing values are denoted by this sign. So if you look into this data, you will see here that this is the data where the the value is missing. So now I have applied the code, and you can see it in here that the interrogation sign has removed converted into NA. So now if I want to change a column into numeric data, I can use this code. Then I want to change the NA into the median value. I have enter this date, these codes. Let me apply the codes, and then I will show you what I just found. So these are the codes. You can also change the codes, like this is the code. I want to change the values from 0, 1, 2, 3, 4 into benign, grade 1, grade 2, grade 3, and malignant. You can see it in here that there are so which one is the column? Class. So this is the class column. You can see these values like 2, 3, 1. When I enter this code, it will change these values into the benign, grade 1, grade 2, as you can see here. So this is the data wrangling. You can use your data and AI to wrangle your data and pre-process it through the R and Python. Your data may be different, my data is different, so you have to ask the AI, ChatGPT, Kim AI to DeepSeek to give you the code. Whichever AI are you using, It can give you the codes and you can just edit it according to your data, and it will change your data into an organized form. This is the data merging, in which we merge two datas. These I have already done in another session. I will share the link in this after the lecture. So this is our data wrangling. First we have to change our data into an organized format. Once our data is organized, then we can move forward into data analysis. In the data analysis, at this stage, clean data is explored and statistically examined. Like first we have to do descriptive analysis. In descriptive analysis, what we do, we summarize and describe characteristics of data. We use mean, median, mode, standard deviation, percentages for qualitative, quantitative studies. And the example is the average BMI of a study population is 26.5 with 40% overweight. So this is the mean, and these are the percentages of overweight which have given. So the first step to understand data before deeper analysis is descriptive analysis. I am not going to do the descriptive analysis as I have already done it, given in this link. You can use this link and go to the YouTube, and it will give you. Let me go to the YouTube. Let me show you where you can access it. So okay, there is website, a channel we have already created, universal digital health. You can go there, you can go to playlist, and in the playlist there are various playlists. So the descriptive analysis is done in this GBD data analytics with R and Python. In this playlist you can see these are our various lectures on inferential statistics, descriptive statistics. So this is the descriptive statistics. You can watch this video for descriptive stats. I have put it the data that the data is 2334 similar. Okay, now coming to our next section in data analysis. The next section is inferential analysis, which goes beyond description to make conclusions about a large population from a sample. The tools are hypothesis testing, regression, t-test, chi-square, survival analysis, ANOVA, and many more tests. Example is patients who smoke have a significant higher risk of lung cancer, and the p-value is less than 0.05, then it will be statistically significant and we will accept the alternate hypothesis. You can also watch the second video for inferential statistics here. This is the inferential statistic video. So you can watch it and learn how to use R or Python for regression, inferential statistics. This is the whole video on inferential statistics. Now the another analysis is predictive analysis, which is used for historical data to predict future outcomes. What will come in the future if we analyze this data? The tools used in this method is machine learning models like decision trees, random forest, and neural networks. You can make these codes for every analysis through ChatGPT, DeepSeek, and Kimi-K2, whichever an AI you are using. So the example of predictive analysis is predicting which patients are at risk of hospital readmissions within 30 days. And the role of this analysis is preventive, personalized medicine, and early warning systems. There are no videos on this yet. Once we created videos on these analysis, we will upload it to the Universal Digital Health and you can watch it there. The fourth one is prescriptive analysis. Also, the video is not made yet. When the video is made, you can access it as it is free for all. The purpose is recommend action based on data insights. The tools are optimization models, simulation, decision support system, and the example for prescriptive analysis is recommending the best chemotherapy protocol for a cancer patients. So after the data analysis, the another basic stage in health data science is data visualization. How can we convert our data into visuals? And the visualization is the translate numbers into meaningful images that are easier to understand. The common tools are histograms, scatter plot, heat maps, dashboards. There are many other visualizations. Okay, the role in health data science of data visualization is it helps identify trends and anomalies quickly, facilitates communication with clinicians and policymakers. You can also visit these links which are already done here. Like this is the secondary analysis for GBD data using R and Python, and the second one is GBD data analysis in practice. These two videos are about visualizations. Like you can see here, these videos are all already made, so you can access it and watch how to create your visualization from the data. So this is done for GBD data. You can also do it for your data or another data from another website like Kaggle CDC platform. And this is another video for data analysis visualization. खट्टा जायका और okay, let me pause it. So the data visualization is the process in which we convert our numbers into meaningful images. And you can see the two lectures here given is the links in the Universal Digital Health. So after data visualization, the next thing is interpretation of the data. Interpretation means we have to write the results, what we get from the data. After doing data collection, then data wrangling, then data analysis. After data analysis, we have to write our results which will be used for the data to be analyzed, or which will be used for the data which is analyzed to be used in our society for health problems. The frequent questions asked in interpretation is what do these results mean for patients, providers, or policymakers? Like how the data will be used for the society to help the patients, provider, and policymakers to change the health outcomes into a better ones. Are the findings clinically significant, not just statistically significant? Are our data can be used, our results can be used, which can make a difference in our society? And could there be a confounder or basis? We should always write our basis, our study basis in the results or discussion section. Example is a predictive model shows high risk of diabetes in young adults. Interpretation involves understanding risk factors and not just reporting numbers. So after the interpretation, the next section or stage is decision making. We have analyzed our data. We have collected data wrangling, analyze, then data interpretation, then done. Now, why have we done this analysis for? We have done the research or analysis to make our health system better. So the last section is what will be our decision from the interpretation of this data. What will we do next to help make our health outcomes better? So the ultimate goal of data science pipeline is to support decision. The decisions are on various levels like clinical decision, choosing the best treatment for patient. We have seen that many medicines which are used in the past are now considered to be harmful. And the new medicines which have come to the market are used instead of the past treatment because the new treatments are better with less adverse effect and side effects. The second thing is public health. We can use our data in designing vaccination campaigns, in making our society sanitation, hygiene, water, disasters to control it and prepare for it. And then there is a policy which is the main pillar. In policy, we allocate resources. Like if we have written the results, if we have done the analysis and interpretation, after that we have to give our data to the policy makers. These are our findings, and now we have to allocate our resources to this new treatment or this new strategy to make our health system better. The key requirements for decision making is decision must be based on reliable evidence and ethical consideration. So the evidence must be scientific, reliable, which can change our health outcomes into a better ones. Example is using AI driven images to decide which cancer patient should receive urgent surgery or medication. So the conclusion of our this lecture is the data science pipeline in health is the structured pathway through which raw messy data is transformed into meaningful knowledge and decision. It begins with data collection and ends with decision making, which applies these insights, the results, interpretation to improve patient care, public health program, and health policies. In short, the data science pipeline ensures the health data is not just stored, but transformed into actionable evidence that saves lives, enhances healthcare quality, and supports informed policy. As future health data science, you will face many challenges at each stage of the pipeline, but with a solid understanding of these stages and the tools at your disposal, you can make a significant impact in healthcare. Like if at any stage you encounter a challenge, you can use many tools for it to solve it. Like in the data wrangling uh, stage, you can use AI tools to make it organize data. Then in data analysis, if you don't know which analysis is good, then you have to use the AI for it, that this is my data and how can I make it comprehensive analysis. So it can also the AI can also give you the idea of how to use the data for which analysis. Thank you. This is end of our lecture, and inshallah we will we will be meeting in our next lecture. So in this lecture, the main concern is the six stages: data collection, data wrangling. The data wrangling is already done in this lecture. Like you can use AI for it, and you can make your data structured form. Then the data analysis in visualization is already done in Universal Digital Health channel. You can access it. It is free, and there are many lectures on it. Not only this playlist, like there are also other playlists for it. These are our playlists. This is the analysis from the analysis playlist. The other playlist, this is the master in health data science playlist. So okay, all our analysis will be uploaded